Hello, everyone. This is Tom Fox back for another episode with Dr. Byron Black. Dr. Black, welcome back.
Thank you. Glad to be here.
Dr. Black, today we're going to take up the topic of medicine, but I want to start with you are a PhD doctor and not a medical doctor. Is that correct?
That is correct.
And let me just ask, you're not telling the listeners to go off medication without consulting their primary care physician, are you?
Correct. I am not saying stop your medications. Only your physician can tell you that.
With that, maybe you could give us an overview or discussion of the number of drugs that have been developed for diabetes and how prevalent they are here in 2023.
Currently in 2023, we have 10 classes of diabetes medications and 73 actual medications. And it just keeps growing every year. They keep developing more and more. And the sad thing is they keep developing them, but the rate of diabetes keeps going up. As we saw in a previous one, we're at something like 38 million diabetics. And the medications, in my opinion, aren't doing the trick.
The figure you cited actually told us about in episode 1, but in episode 3, you told us an interesting fact which involved the muscles and their role in both helping the condition of diabetes, but also how, unfortunately, they can be used to further the condition of diabetes. And I wanted to ask you, from your perspective, once again, a PhD, not a medical doctor, are these medicines designed to work on the muscles or do they work more on the organs of the body?
They are designed mainly to work on the organs of the body. They work on the liver to prevent it from secreting more glucose into the bloodstream. They work on the pancreas to prevent to make the pancreas put out more insulin, or they'll work on the intestines to not break down carbohydrates or not absorb them. And so they work on all the other places except where they need to work, which is on the muscle cell.
So you had a great analogy about that. Could you share with us that analogy you've come up with?
Thank you. Yes, my analogy for diabetes medications using the hill country here is shutting down Sidney Baker in an attempt to stop traffic on I-10. You can shut down Sidney Baker and it's going to have a small effect on I-10, but that traffic is going to just go to another on-ramp, say Harper Road, and get on there. And so you're going to have to keep shutting down more and more on-ramps in order to stop the traffic. And you're never going to do that.
Because I-10 is the main carrier.
That's right.
And so you want to try to work on the main carrier, and that, as you understand it, is the muscles.
Correct. I found out that we have, my first time dealing with the diabetic, I learned two things. I learned that we have over 660 skeletal muscles on our body, and that they are responsible for 75 to 80% of all glucose uptake. So if they're responsible, if they do that much glucose uptake, why aren't we using them? And so that's where exercise comes in.
Now, we're going to take up exercise specifically in another episode, but as I understand it, at least what you've taught me is that you move towards exercise and more exercise. And as you move towards that, then you can have a discussion with your physician about, do I need to continue medicine? Could you maybe expand on that a little bit?
Yes. The diabetic must control their blood sugar. And if they're not exercising, then the medication is the only way they're going to do it, along with dieting. But it's not, they need to add exercise to that, and they need to keep taking their medication and start an exercise program. And then when the exercise is taking over the role of lowering the blood sugar, then their physician can tell them to stop the medications. But only the physician can do that.
I assume you have a variety of clients, patients, customers, sort of in a range of medications, some perhaps heavy, some perhaps middle, some perhaps light, moving towards a more exercise-based. Is that a fair assessment?
Yes, sir.
And have you seen that progression where as you move towards greater exercise, you can reduce with appropriate physician oversight to your medicine?
Yes.
And is that a conversation that your patients or your clients and your customers have said they have had with their primary care physicians?
Yes.
And are physicians open to that type of conversation with their patients?
Yes, they are. Most physicians want their patients exercising. And so when my clients, their patients, go to them and tell them that they're working out with me and that one of their goals is to come off medications, then the doctor's more aware of it and can work with them to help them meet that goal. So between my exercise and the doctor watching over them, eventually they can come off medications or reduce their medication.
I have to pick up on that last point, or one of your last points, because I just finished a podcast series on the future of healthcare. And one of the key discussion points was patient awareness and patients taking, if not control of their own healthcare, at least having a big role in that. And it sounds like that's what some of your patients are doing around this whole process. They're obviously working with you on exercise, but they're also having discussions with their primary care physician about what's needed from medicine or pharmaceutical perspective as well. Is that something I guess that means you have observed that yourself?
Yes, sir, I have. When I sit down and talk to them and we talk about their medications, it's always one of their main goals is to come off medications. And I tell them right away, I can't tell you to come off. I said, but you can talk with your doctor. And as your blood sugar gets better through exercise, gets lower, then your doctor will be able to pull you off of that.
Do you have, or how often do you see your clients testing their blood sugar? I've known people who had to do it daily. Mine gets tested once every 6 months when I have to go see my physician.
Right.
Is there a happy medium, or is it really up to the individual in conjunction or discussions with their primary care physician?
That is between the individual and their primary care. When I'm first starting working with diabetic, I will tell them, especially if their blood sugar is extremely high or their A1C is extremely high, then I will tell them that they need to do their finger prick or their blood check before they come work out. Because if it gets too high, if it's too high of a level, then it's not safe to work out because the blood's too thick. But most of the time, that's up to them.
So we're moving towards the end of our time for this episode, but if I could maybe ask you to summarize a couple of points, I'm going to reiterate it to start with. Number one, do not go off your medication without consultation of your primary care physician. Can we agree on that one?
I can 100.
Okay. From there, how do you counsel a person to have that conversation with their primary care physician?
It's not very hard. Like I said earlier, that's usually in their goals. And when I tell them that, when I talk to them about how exercise affects blood sugar, and that's the way to get off of the medication, then they're very happy to have that conversation with their doctor. A lot of times, unfortunately, when they go to see the doctor, they're not very compliant. They haven't been doing the right things. And so they straighten up and start trying to do the right thing. And that's going to their appointments.
That's what compliance is all about.
That's
doing
right.
the right thing. I'm glad we got that one in. That was for you, Andrew. Dr. Black, unfortunately, we are near the end of our time for this episode. But before we leave, if our listeners wanted any more information on any of the topics you've touched on this podcast, what would be the best place or places for them to go?
They can call me or text me at 210-569-4129, or they can send me an email at bkblack_99@yahoo.com, or they can reach me on my website, mfcok.com, or my Facebook page, Medical Fitness Clinic of Kerrville.
Dr. Black, I greatly look forward to continuing this conversation.
Thank you.